we should start, otherwise we'll be running late. So welcome everybody to our monthly webinar. May, we've made it. Woohoo!
Yes,
Every
yes.
time there is a month coming up, you think, oh my gosh, will we be able to do this goal, this objective that we have set ourselves? And by
Yeah.
God's grace, we have been able to do it. And the topic this month is really, really, I think, timely on the use of social media. Just before, I want to share that we are recording the sessions because we like to keep them on our website for other members to be able to learn and share wildly. So I will, it's Elizabeth Pearson, for those who don't know me, which is bad if you don't. The interim president for UNAMCA, really privileged to be here to share and learn with you. I'll hand over to our moderator for today, Caroline. Please bear with her. Let her take her time because we are all learning on this, and so just bear with her in case of anything. So over to you, Caroline. Thank you, everyone.
Thank you very much, President Elizabeth. Hi, good evening, everyone. My name is Caroline, and I am an RMN by profession, and I just want to welcome you to our monthly webinar today, which happens monthly, as our president has stated. So here we discuss various topics of interest to our profession. So it's a learning, it's a moment for us to learn and for professional development as well. And today we're honored to host three guest speakers. And we have Felicia Kweku. Is it Kwaku? So I'm sorry if I pronounce your name. Kwaku. Yeah, Felicia Kwaku. She's an associate director of nursing and also a senior head of nursing in acute specialty medicine. Felicia is also a chief nursing officer. The officer's Black Minority Ethnic Strategic Advisory Group.
So I'm the chair of that group, Caroline, the chair.
Okay, yes, all right then. You're very welcome. And we also have with us Stuart Tuckwood, who is the National Officer for Nursing at the Unison. So you're very welcome. Stuart's work involves the union and he promotes and defends the interests of nurses. He's also a registered nurse by background. And we've also got Wendy Olayiwola. She is the president of Nurses Association in UK, Nigeria's Nurses Association in UK. And she's also a national maternity lead for equality at the NHS England. So you're all welcome. And so our topic today is about the use of social media for nurses, and we all know so much is going on in the media, and I'm so excited about this topic because it provokes so much thinking, so much debate, and I'm really excited about it. Just so before we start, just some house rules, just to make sure that people have muted themselves, and when you're ready to speak, you unmute yourself. You can raise your hands if you wish. You can use emojis. Sometimes if your camera is not on, you can just use an emoji to raise your hand. And obviously drop your questions in the chat, and we will endeavor to answer all those as much as we can. And then at the end of the meeting, we'll have some Q&A sessions. Thank you very much. So now, without any further delay, please let's welcome Felicia Kwaku to give us some
top tips.
Yeah.
Hi, everybody. I want to thank Elizabeth for inviting me. It's good to see people here and to say hello to my fellow speakers as well. So I think the topic today is around social media and all that it encompasses. So we know that social media is mostly a tool for good, isn't it? So you can obtain really good information, you can make networks, you can collaborate on lots of social media platforms, and and I suppose especially in these times, in these COVID pandemic times, the whole digital landscape is completely transformed, hasn't it, and transitioned, because we've had to do more things and care more using the digital landscape, using the digital space. So so we know it has lots of added advantageous opportunities as well. And I think for nursing midwifery, in terms of accessing platforms, it's been very good as well. You can obtain really good sources of evidence-based practice, research articles, audit, and it also enables connectivity, not just nationally and with your friends and family, but also globally. And so, and it's also good for a learning platform as well. But we should also be mindful that there may be limits to social media as well, and that we have a responsibility, especially as registrants within this country, registered professionals, to make sure that we use social media responsibly. And you will find that many organisations now have social media platforms, policies. And then we also have specific guidance from our regulators, the Nursing and Midwifery Council. And I would also imagine that there would be social media policies and protocols also for whatever discipline you're in, whether you're a doctor, a physio, whatever disciplines, that social media policies will cover all the disciplines. So for nurses and midwives, we are governed by the code. And just to highlight that when we talk about social media, that also includes how you use websites, how you use blogs, how you use various discussion boards, how you share personal and professional content online. And that also includes text, photographs, images, video and audio files. And there have been many staff that have been caught out by messages that they think are personal, but actually have implications if they are inappropriate and used unprofessionally. So what points do I want to cover? I think we must be really clear that we all have a professional responsibility to use social media responsibly. And whenever you're using social media, it's really important that you maintain the privacy and dignity of yourself, but also you maintain the privacy and dignity of the people that you are caring for. And in that context, we mean patients, relatives, and other colleagues. And the code, and and there will be codes for different professionals, is very explicit about how to use social media responsibly, but also what is not acceptable. And I'm just going to kind of highlight the practices when you're using social media, what would be unacceptable. And one of the key things to remember is that as a professional registrant, that actually you place your registration at risk. And that could be for a registrant and a student if you act in a way that contravenes the protocols and tenets of your regulatory body. And if what you post and how you use social media is considered unlawful, you also risk your registration. So that is the context, that's the kind of governance and the reasons for and what the limitations might be. So then let's just really talk through some of the examples around social media. So what we would consider unacceptable practice would be sharing confidential information inappropriately. And that could be friends, family, and especially patients. You are not permitted to post any pictures of patients and people receiving care without their consent. And if you're working within an organisation, you should seek to understand what the policies are, and you should always seek permission, especially of patients and clients, their consent before you post any of their images. You must not post inappropriate comments about patients, and I've been on the receiving end of many queries from the NMC about nurses posting inappropriate images of patients, and that could be even their devices. So there's something about their personal profile, but it could be even specific equipment and devices. You should not post any matter or material that would be considered bullying, intimidation, and exploitation of people as well. You must not also pursue building relationships with patients and clients on social media as well, and any other kind of service users. And that's very explicit as well. And we have had professionals and registrants forming relationships with clients and patients, but also they've discussed and posted those kind of discussions on social media. You risk your registration. You also risk penalisation from the authorities or the police. The other things to be mindful of is ensuring that you don't steal personal information or you use somebody else's identity. So we have, there are histories of people posing, professionals posing as other professionals. I think an example would be, sometimes in the overseas registration process, you think you may be interviewing somebody, and actually you're not interviewing that person. It's somebody else that is interviewed instead of that person. It's really important that you don't position yourselves in terms of behaviours on using digital platforms that will incite violence or encourage violence, or incite or encourage self-harm. So I'm thinking specifically of self-harm websites, and there are suicide websites as well. And it's really important, especially in terms of our cultures around equality and diversity and equity, that you do not use digital platforms to incite hatred or discrimination. So those are the things for professionals. And if you also witness or observe behaviours that would contravene the reasons that I've just listed here, I think you also have a responsibility to raise that if it compromises people's dignity or goes against particular protocols. So we have responsibilities as professional registrants to uphold the tenets of our codes, whatever profession you are, and to always behave in a manner that doesn't bring the profession into disrepute. So those were some of the key things that I wanted to highlight today. And and just to note that people have been struck off when they have posted things inappropriately, and people have been also brought in front of disciplinary and professional practice committees as well when they posted things inappropriately. So sometimes when you're discussing these items with staff, sometimes relatives and clients can be very abusive to professionals and registrants. And I have heard anecdotally that in response, some staff have talked about those patients and clients because of the level of behaviour that they've received from them, but it's still not permissible. Absolutely not permissible to share information about patients, clients. It's just not permissible. And even if patients or clients may say it's okay for you to post it, it's still not permissible, and you need to follow the regulatory and policies within the organisation. So those are the key headlines that I really wanted to bring to you today. Any questions? I'm just checking the chat box. Okay, so one of the questions here is LinkedIn uses professional leads for independent practitioners, which can be assumed as persuading a client or patient. How do you deal with this? So can somebody explain, just give me a bit more detail around that?
Do we know who posed this question? It says Yunma. Is that Elizabeth?
Let me try. Yeah, I think with LinkedIn, you know, you can get leads from there. And so if you're, for instance, you're maybe selling a product that
Yeah,
an end user, a patient's going to use it, would
yeah.
that be pursued as, you know, pursuing a, you know, a client, like you've said, you know, it's very, it could be intimidating because you want the person to sell, you want a deal, you know, struck. But how would you deal with that?
So it depends if the person is acting in a professional, um, you know, if it's their personal business, as opposed to if you're doing things on behalf of organization. And if you are pursuing that business lead on behalf of an organization, you have to follow the kind of purchasing and commercial policies that are laid down by the trust. If you're doing it personally, then I think if you're a healthcare professional, I would also check in with perhaps your union or your professional organization to see whether that is permissible. And I think if there's a level of a doubt or hesitancy, then I would always check. And whatever you do has to stand up to scrutiny. So if it doesn't feel right, do not do it, and always double check. Okay, so always double check, and especially if the client may tell you that they feel, you know, a bit harassed or they feel pressurized, you would need to stop.
Okay. So there's mine is sort of like a comment question kind of thing. There was a few months ago there was a clip that was circulating on social media about this carer with her client at home, and it appeared to be that she was recording it, and the client was being aggressive towards her. I think she was spitting at her, or and threatening her and asking her to leave. Possibly the lady was, had dementia or not. We're not really so sure about it, but she was an elderly lady. And so the question here is, is it right for, as we receive it, to pass it on? What are the
It's not
implications of
permissible. It's not permissible.
sharing such things?
It's not permissible. It's not permissible. So the carer risks. So obviously it's clearly the patient is being abusive. So there are protocols around that, which is around zero tolerance, which is around written or verbal warnings by the organisation that the professional is working with that can be issued to the person who's abusing them. There's also the checking of whether the patient or client has capacity, because those then have an impact in terms of the client or the patient's behaviour. So it is not permissible, and the person always needs to seek advice from their employer, or they risk being disciplined or being dismissed from their post. So even in certain circumstances of abuse, you need to follow the protocols, report it, complete incident forms, or withdraw yourself from that situation if you need to, but always seek advice. It's not permissible to circulate because if the client has a general reason for behaving like that because there is something organically wrong or neurologically or drug induced, then that carer has no leg to stand on for doing such things. And actually, we've got to conduct ourselves in a professional way at all times. We're in the caring business. We've got to recognise that.
Thank you so much, Felicia. Actually, so I think, thank you, Caroline, for raising that, because that actually happened in our WhatsApp group. Sorry for barging in, but so we felt, the leadership, we didn't know how to deal with it. And I think this is how the conversation of having this topic today, how to understand a clip coming into our midst, how do we deal with it? Do we immediately delete it, or do we, can we learn from it? So thank you so much for sharing that, and for being mindful that, because at the end of the day there's a patient in this video and we need to keep their confidentiality safe. So thank you so much, Felicia. And I know you have to run, but
yeah, there's one. It's okay, I've got a few more minutes. Tim has asked a question on the chat box. How about where a healthcare professional shares a viral video secretly recorded which has within it, for example, a patient who was being abused? So once again, I think there are some policies around covert recording. So there are some policies there. so people would have to check what that policy was. Covert recording, that wouldn't be acceptable, but I think there is a discussion to be had about the patient's vulnerability and the level of harm. And I think that there are generic policies around whistleblowing, and that may be interpreted as a whistleblowing. But whatever you do, whatever an individual does, they also need to understand there's a patient at the end of it, and the patient's image is gone public. So for families, for friends, for the patient as well, there is a compromisation of their dignity, even in those circumstances. So the best way is to make sure that you report it to the required and appropriate authorities. It's still, so although the patient is vulnerable, it exposes them as well when people do that. So it's really important to make sure that you follow organizational protocols and policies. And, you know, where need be, people can report those incidences to the authorities as well. And I know that there are a number of cases where there has been covert reporting, and the person who's done the covert reporting has actually come under scrutiny themselves.
Sorry, can I?
Does that answer it, Tim? Does that answer the question?
So Felicity, I've got a question, please.
Yes.
I've worked in an environment. So my name is John Gideon. I'm RMN, and also work in a crisis team in the community currently. And I'm the patron of this, one of the, I work in an environment, for example, where a patient starts recording stuff on a ward, and they saturate these clips on the social media. And also, in some instances, police comes in when they are called and they have got body-worn cameras, which means they are actively recording what's going on in a ward environment. How do you deal with such incidents?
So a patient, once again, is not permitted to film, record an individual without their express consent. It's not permitted because you're basically breaching their human rights. So if that is proceeding, then the person, you know, ensuring the client or patient safety may need to withdraw themselves from that particular situation and then seek advice. Okay, they do really need to seek advice. You also mentioned then that is it police came in. I think police have different powers, and they carry the video cams. So I think that within their constitution, they are permitted to do that and to film that. But once again, the person can stop what they're doing and also, you know, have a discussion with the police and various authorities as well. And that I mean, police record all the time.
When the police record,
yeah.
They're in an environment which is not a public place, which is governed by the NHS, for example. Yeah. Which means public order doesn't apply in such environment. So can they be stopped from recording where we've got CCTV on the unit?
So you can quote your constitutional rights. So I think people can question that and can cite their constitutional rights, but we would have to look up the guidance on police powers in a public place. And I'm not familiar completely with those bylaws. So I think as an organisation might need to look at that and feed that back to staff. Has that answered the queries that you've had?
Any more questions, guys? Because
Tim
before we move
had
on
a
to
question.
the next speaker.
Tim had a question, very important question. Tim?
I have one or 2 minutes more.
Oh, no, I think Felicia is responded to it. Yeah, thank you so much.
Okay, then I will log back in as I have to travel now. And thank you for having me. Thank you.
Thank you very much. We much appreciate you. Thank you so much.
Yeah, thank you.
Okay, now I would like to welcome Stuart Sekou to give us to talk about his role and what we can learn from him today. Thank you very much.
Yeah,
Welcome,
thank you.
Tim.
Thank you, Caroline, and thank you for the invite as well, Elizabeth, for having me tonight. I think I had a couple of slides. Can they be shared with everybody? Is that okay? And I'll try and add to what Felicia said, but Felicia obviously has covered some really good issues already and given you some really good advice.
Yeah,
so,
let me just put them up. Well, give me 1 second.
Yeah, no problem. Thank you. So, yeah, hi everybody. I'm Stuart Tuckwood. I'm the National Officer for Nursing at Unison. So I am a registered nurse myself. I used to work mainly in and around Cambridge. Addenbrooke's Hospital is where I worked before I came to work for Unison, although I trained back up in Scotland in Glasgow before I started working for Unison. Thank you. So I spend a lot of time liaising with the NMC and the NHS and lots of other national organisations to represent the whole nursing family. So registered nurses, but also nursing associates, healthcare assistants and support workers, and lots of different roles within Unison. And but I was also actually a Unison steward and a representative while I was working as a registered nurse. And in that role, at various different times, I had to cover issues and complaints that were related to the use of social media. So actually, I can tell you a little bit about how to deal with these things at a local level, and also maybe give you some information and background from the kind of national perspective and national policy on the use of social media. So hopefully what I say is interesting and useful, but I'm also happy to stay behind and take questions later. And if there is things that perhaps come up that I can't respond to now, I'm always happy to go away and look at things and then come back and try and give an answer later. And can I just say as well, it's great to make some links with your association. We're trying to do a lot at Unison at the moment to try and reach out to overseas nurses and migrant workers to make sure that we're supporting you as best as we can to protect people's rights. And it's just great to be able to link in with organisations like yourselves so we can hear about concerns and things that are worrying you. So I had a really good chat with Elizabeth recently, who updated me on a lot of issues. But it's great to be here tonight with you. So yeah, the next slide, please. I've got some notes here. So yeah, so I think that what I wanted to say just to start with was during the whole pandemic over the last year and a half, and particularly back at the beginning of it, a lot of questions and concerns came to us at Unison about the use of social media for expressing concerns about things that were really worrying people. So not just, sharing messages to friends and family, but speaking out about concerns like inadequate PPE or working in an unsafe environment. And this was obviously a time when people were very stressed, people were really anxious, still like that in lots of places. And people wanted to raise their voice and they wanted to speak out about things. And it put us in a difficult position because we want to obviously make sure that we protect individuals. We want you to keep your registration. We don't want you to face disciplinary action. We want you to be able to raise concerns appropriately, but we don't want people to feel gagged. We don't want people to feel like they can't raise concerns. So I think a really good place to start with is to talk about, when we're using social media, that we do support your right and the right of staff in the NHS and the right of nurses to raise concerns and to speak up. And when we talk about protecting yourself in terms of how you use social media, this is absolutely not about gagging you and making sure that you can't speak out about things. So the real question is, how can you do those things safely and appropriately and protect yourself while also maintaining your right to speak out and your right to raise your voice about things? So some of the key messages that I'm going to try and give you and talk about are knowing how to go about raising concerns properly and appropriately, how to escalate things formally where needed so you can speak out without putting yourself at risk. And I'm going to talk a little bit about your professional obligations and duties as a registered nurse or midwife or nursing associate, because unfortunately this area isn't always completely clear. There are some things that are definitely things you must not do when it comes to social media, but when it comes to things like threats to patients or public safety, then it does require you to properly think about things and think about how to maintain your professionalism. So I'm going to talk a little bit about that. So could we go on to the next slide, please? So when we're talking about professionalism, as Felicia has said, it's explicitly part of your NMC code as a registered nurse, midwife, or nursing associate. As it says here, you have to use all forms of spoken, written, and digital communication, which includes social media, responsibly. And so we'll come on to what that means about using social media responsibly. But as you'll see in the second part of that sentence there, respecting the right to privacy of others at all times is absolutely crucial, really integral in what the NMC says. So when it comes to maintaining your professionalism and acting professionally, as a registered nurse and midwife or nursing associate, you have to protect people's confidentiality and their privacy at all times. So when it comes to coming home from work and wanting to talk to someone about how bad things were, or wanting to share a message with a colleague about how stressed you are or how difficult things have been, you absolutely must make sure at all times people can't be identified. Your patient's right to confidentiality and anonymity is always protected. But one of the additional things that make this a little bit more complicated is, does that include where you work? Does that include the kind of area or clinical setting that you work in as well? And that's, again, I'm going to keep coming back to this, something that you need to think really carefully about. If someone can identify the area that you work in, if, for example, you use Twitter and on your bio you have staff nurse, Addenbrooke's Hospital, like where I used to work, you may, even if you don't identify any patients or any staff you're working with, if you say, things were terrible in my ward today, our staffing levels were really unsafe, and you can be identified as working at Addenbrooke's Hospital, then there's nothing stopping a journalist taking that tweet that you've put in the public domain, using that as the basis of a story, and before you know it, you're being quoted as a staff nurse at Addenbrooke's Hospital who has done this and that and who's exposed unsafe staffing levels, and you can find yourself in lots of trouble really quickly. So when it comes to protecting confidentiality and privacy, absolutely do not share patient details or information ever, but you have to think a little bit beyond that as well, and potentially take more steps to protect yourself. I've put a YouTube link in there, which I'm not sure you can take off the slides, but I'll put it in the Zoom chat just afterwards as well. And that's a video that the NMC recently produced, a short animated video. I think it's only 2 or 3 minutes long, which summarizes some of your rights and responsibilities when it comes to using social media. I'd really recommend you watch it. It's quite good. And the unions, we had an opportunity to talk to the NMC and say what we thought would be useful to include in that. And it just goes to show that the NMC know this is an issue as well. So they're trying to do their best to make sure that you as registrants understand how not to get yourself into trouble. So please try and look at that. It would be really helpful. I'm going to highlight a couple of other points of the professional NMC code that also relate to social media, which go a bit beyond this. So another part of the NMC code says that you should never use your status as a registered professional to promote causes that are not related to health. So this is another element of why it's important to think about what you're using social media for. If you're a registered nurse, people trust nurses. Surveys often show that nurses come very, very high up in terms of all the groups of people or professionals that the public trust, and rightfully so. But does that give you a right to promote other causes because of the basis of the fact that you're a registered nurse? And you have to be very, very careful with that. If you decide to be involved in some kind of business that you're profiting from, or some political organization that you believe in, and you use your status as a registered nurse to promote that cause on social media, you could be getting yourself into some slightly difficult problems there. And that's becoming more and more difficult, I think, as lots of people use social media as a way of marketing themselves. And it's a very natural thing to do, to try and big yourself up on social media, to talk about all your experience. But you have a professional integrity as a registered nurse, midwife, and nursing associate. And if you're beginning to look like you're profiting from that status, then people could call into judgment your professional integrity. So you could be getting yourself into some trouble. There's another part of the code that says that you should make sure you do not express your personal beliefs, including political, religious, or moral beliefs, to people in an inappropriate way. I think most people, when they read this section of the code, think about their interactions directly with patients. So obviously, if you're a nurse or a midwife who works in maternity services or with women who are maybe terminating pregnancies, you obviously understand that you cannot, regardless of your personal views, give those personal views to those women, because you might be making them feel very uncomfortable while they're accessing healthcare, and that's not fair, because that's a personal belief of yours. You also obviously wouldn't express a political belief to a patient in an inappropriate way. But those things also apply on social media if you're identifying yourself as a professional registrant again. So this is where you need to be thinking as you use social media. But that's the mark of being a professional, is that you've got judgment, you've got thought. So you should always be reflecting before you post something on whether you're pushing it a bit too far. And I don't want you to go away thinking that you can't use social media to talk about politics or religion or moral beliefs, because just because you're a registrant doesn't mean you're not entitled to those beliefs. Doesn't mean that before an election you're not entitled to say you think people should vote one way or they should vote another. But you have to use your judgment and think about whether what you're doing is inappropriate. So it's one thing to say, I would prefer you to vote for the Labour Party. And it's another thing entirely to say, I think voting this way makes you a bad person. Or, you know, people say obviously lots of abusive things on social media. If you're being abusive about people that hold other political opinions and you're identifiable as a professional registrant, then you're definitely pushing the boundaries of what's acceptable, and you could find yourself getting in trouble. And one other thing I think is important to emphasize is just that always being respectful and always being appropriate. So you wouldn't expect a nurse, midwife to be rude to you face to face. And unfortunately, that kind of holds on social media as well. So it's absolutely fine to disagree with people. If you take part in social media, which has lots of benefits for talking about professional nursing issues, you'll find that there's lots of disagreements, and that's fine. You know, we've all got different views on things, but what you can't do is be disrespectful and rude to people. And if someone was to make a complaint and someone took a screenshot of you being abusive or challenging to someone in a way that was discriminatory particularly, again, you could find yourself in lots of trouble. And also, I think, not pretending to be an expert on issues on which you are not an expert. Again, a good general rule to stick to is, would I say this to a patient face to face? Because often it's very different with the internet. You feel anonymous, you feel maybe more empowered to say things. If you wouldn't say it directly face to face to someone, that should ring alarm bells about whether you should say that on social media. So as a professional, you're expected to stay within the realms of what you're competent to do. It would be wrong for me to go and speak out on social media about the side effects of the COVID vaccines, for example, and pretend that I was an expert. I'm not an expert. Being a registered nurse doesn't mean that I'm an expert on the side effects of vaccines. And if I was doing something that undermined people's confidence or changed people's opinions or views on vaccines, then I could be going beyond what was acceptable as a professional. So again, thinking carefully about all these things is really important as you use social media. Can I have my last slide come up, please? So a couple of just top tips, and then I'm going to just give you one or two examples from my own personal experience and talk you through them. I would always say, stop and think before you post something. Definitely don't post anything once you've had a couple of glasses of wine or anything, because your judgment may be slightly impaired. But at all times, it's always a good thing to think. Once something is on the internet, you can't take it back. Even if you delete it, it may be too late. So really, really use your judgment and think carefully before you post anything. Absolutely never share private information of patients or colleagues. Always be professional and respectful, even though you may be disagreeing with people. And you'd expect to hear this from me, but I think it's really important for all professionals, for this issue and for many others, to be in a union. I'll talk in a second about a couple of examples of cases that I've dealt with for people with social media. But in some cases, complaints about your use could be quite unfounded, and actually you could find yourself trying to explain to a manager or in bad circumstances the NMC why you've done something, but actually what you've done has been quite fair. And what you need is support and advice to help you explain that and evidence that, and unions such as Unison can provide that to you. So if you're a member, you can get lots of support that will help you defend yourself. In terms of the professional regulator, the things that I think they're most likely to find contentious about your use of social media are information that risks people's confidentiality or privacy, obviously, messages that undermine trust or the image of nursing or midwifery, and also messages that show that you've got a lack of insight, understanding, respect, or honesty. So if you've been shown to be really dishonest in a message you're doing on social media, that's what they're likely to find really galling and might lead them to put conditions on your practice or strike you off. So if you're being complained against, it's going to be really important for you to show that you understand the code, you haven't acted irresponsibly, and you are careful. And if you can show those things, even if you're complained about, you're likely to be able to defend yourself. So I've probably gone a bit over time, so I'll give you two quite quick examples. A nurse I worked with, a nurse I represented, was taken disciplinary action against because they were working on a shift. They'd taken a screenshot of a patient's notes and they'd shared them on a social media site, they'd blacked out the information, so they thought they were okay because they'd made it sure that it was anonymous and you couldn't see the patient's notes. And they were basically complaining on this social media site that this patient of theirs had an injury because they'd been using drugs or alcohol, and they were saying, this isn't fair, I'm working, I wanted to go out tonight, but I have to stay here because this patient has been foolish, basically. They thought they were okay because it was anonymized. However, if you were the patient or the patient's family, you might have been able to work out who they were referring to. In doing that, she shared some confidential medical notes online, despite the fact that they couldn't be identified, and obviously called into account her own professional integrity, because people could say, well, how can you judge your patient? That's not fair, you're expressing your own opinions. In the end, this nurse wasn't struck off, or they had a warning taken in, but they could have had themselves in some really serious problems. But the way that we were able to help them was by showing that she went away and she read the disciplinary code, she made an effort to understand what she'd done wrong and to show that she would never do it again, and made a real effort to show that she understood and had insight into this, and why it was a big mistake, basically. And fortunately, because of that, they were fairly lenient with her. One other example, well, and this is a personal example, I use Facebook. Well, I did use it, I don't have a public profile anymore, and I used Messenger. Sometimes people add you as friends, you think you've seen them, you think that person looks familiar. Someone added me, I accepted them as a friend and things, they tried to start a conversation with me. And then I realized a little bit later on, they actually were a patient of mine that I'd looked after. And, I thought, wow, I could be in quit a lot of trouble here because this is an inappropriate kind of conversation. They were very friendly. They just wanted to say thank you for care that we'd given to them. So it was very innocent, but actually I did have to kind of say, it's inappropriate for us to have this kind of relationship or conversation on social media. And I had to draw a line under it and end it there. And I think in that circumstances, if I was to face a complaint, I would be able to defend myself, because I could say, this is the action I took to make sure I stayed professional. But it just goes to show that even with the circumstances that I was aware of, that I still managed to find myself in a potentially difficult situation. So yeah, there are loads of ways you could find yourself having problems with the use of social media. So as I've said, always think carefully about it and think about protecting your professional image and your professional representation, your professional integrity at all times. I'll stop there, and I'm happy to take questions. I think there's been one in the chat already, has there? Yeah, so someone asked, does this profile only apply to nurses or other professionals too? The code that I've been quoting from was the NMC code, so that applies to nurses, midwives, and nursing associates who are registered with them. But I'm very aware that other professional regulators, as far as I'm aware, they all say something about social media and the use of information. So HCPC, which regulates allied health professionals, they definitely do. And I know the GNC, which regulates doctors, does as well. And I imagine there's something in almost every professional code about that. And someone added a quote just saying, you're expected to act professionally in respect of whatever environment you're in. And that's absolutely true. You're a registered professional. That applies to you whether you're inside work or outside work. Social media is a very public forum, so you have to act as a professional at all times. And if you do that, you're unlikely to find yourself in any trouble.
So thank you very much, Tim. Stuart. My question is regarding a situation where a client records, an audio. He takes a client makes an audio recording, audio recording of their interaction with a professional, and then uploads it on their social media, accounts, and with the tag this professional's names, full names. And so how do you go about that? Because I know of somebody who has experienced this, and it's been very difficult, and they tried to get to get that patient to remove that recording, but clearly the patient would not remove it. And because they recorded a conversation of them with this professional and uploaded it on I think on their Facebook account, on their Instagram account, and on their YouTube account, and actually tagged these professionals' full names. and it's quite a challenging situation. So how do you go about that? Because, you know, everyone was saying at work that patients are allowed, I think they have a right to record, but you know, they recorded that without these professionals' knowledge, or they didn't even give them permission to do that, and just uploaded it, and it's still out there, you know, on YouTube.
I think, I mean, the first thing to say is that you're responsible for your own conduct, not that of your patients. So you know, the NMC, or you know, are not going to, or no one's going to take any action against you because of what a patient has done in that situation. The only thing that you can do is be responsible for your own actions. So when you first become aware of that a patient has done that, and they're using that information in that way, and I think it would be very unfair of a patient to do that, and I don't think they have a right to record someone without their permission, as you said. It would certainly probably go against the kind of contract for them to be receiving services that they did that. So I would say is if that happened to me, the first thing I would do would be to make sure that I raised it with my line manager. So raise it formally with your employer. If you are working for an employer at the time, so maybe you're a district nurse or something like that, and someone's recorded you and you were giving them treatment, make sure you go and raise that to your manager and let them know this has happened. So the difficult thing about that, I suppose, is that they've tagged you in it, haven't they, like you said? So you're aware immediately that some kind of confidential information has been shared. So you can't stop that happening, but you can respond to it. So as soon as you're aware that that's happened, you go and you report it formally. Maybe you take a screenshot or something that you share confidentially with your line manager. So you don't share it anymore on social media. And then it's for your employer and organization to deal with the patient. Unfortunately, it's really unfair on you if that's happened to you, but you can't be expected to police your patients and police their use of social media. So it's for your employer to respond to that. And maybe they need to have a conversation with a senior manager with the patient and say, this is not tolerable. If you do this, you know, we may refuse to give you treatment, or we'll be, you know, we'll have to put limits on the kind of treatment we can give you. The same way you would deal with a patient who is showing racist behavior or showing, you know, discriminatory behavior, you have to give them kind of warnings. So yeah, I mean, report it formally, and then if you needed support, because obviously that could have some kind of effect on you emotionally, because I imagine that would be very stressful. Your employer should provide you with support. So they should be, you know, making sure you've got someone to speak to, they're having a supportive conversation with you about dealing with that. Yeah, I mean, does that answer the question? It's difficult.
Yeah,
but
is it not something that the Unison could help with as well? You know, like, because like you said, you know, emotionally for the staff member, and clearly this individual, the patient is they have mental health issues, but they have capacity, and you know, they know what they're doing, and you know, this person tends to record different professionals, every encounter with a professional, and upload it. And if they know your full names, they'll write it down, they'll put it out there.
Unfortunately, yeah, there is your name as a registered nurse or midwife is available on the NMC code, on the NMC register, so you can be identified, but that's because we want to be held to such a high standard. So it's a good reason to remember why you should always be professional in all your interactions with patients, because that, you know, you should be professional just because it's good practice, but something like that could happen. But yeah, definitely you could speak to a Unison steward in your local branch. I would say speak to your line manager first, because Unison can't go and police the patient either, unfortunately. You know, we can't do that. But what we can do is provide you support if your organization is not dealing with it well. So if you've taken that to a manager and your manager's gone, oh, I don't care, don't talk to me about that. Or, you know, you're saying, I'm quite stressed about this, or I'm finding this difficult, and they're not helping you. That's definitely when you should speak to a Unison steward. Maybe you could take out a grievance, you know, complain formally to your management that they're not dealing with this appropriately. Because if that's happening often, that's very stressful. That's not fair on the professional. So your employer should be taking that seriously. And yeah, definitely, if you think they're not, a Unison steward or representative would be able to help you with that. I think there's a couple of, no problem. There was a couple of questions that came in. I'm happy to answer them. I'll try and keep quick. Someone said, can I share examples of when nurses have been struck off because of such conduct? I don't think, I mean, I couldn't share any, obviously, any confidential cases. I and it probably wouldn't be that much more useful to go into too much detail. But I mean, the kind of things that I've said already, the cases where they definitely will strike someone off are where you've broken confidentiality or someone's privacy. You've done things very, very inappropriately that are kind of gross misconduct. So, you know, maybe you've shown racist behavior or discriminatory behavior or very, very inappropriate things. And then what the NMC are very, very strict on and will be very harsh on you is if you show no insight into what you've done. So obviously, if you've done something tremendously awful, you can say sorry all you like, but you might still be struck off. But if you've done something kind of in the middle ground where you've made a genuine error, a genuine mistake, because people do make mistakes, if you show that you have learned from it, you've read the policies in your organization, you've read the NMC code, you've apologized, you know, and you try not to do that again, then in most cases with proper representation from a union, you can try and maintain your registration. But a lot of the cases where people are struck off are where they don't show up to NMC hearings, they don't engage in the proceedings, they don't ask for help, and they don't show how they've improved. And that's when the NMC get very nervous about what you might do again in the future, and how your professional practice might be questionable. And if they think there's a risk to the public because of that, then they will strike you off. So yeah, it's very important to engage in the process and get help. And there was one more question about, can health professionals use a video in the public domain for learning purposes and discussion points, specifically where they clearly state they're sharing it for learning? It's quite a, Tim, that's quite a broad question, so it's difficult to answer it specifically. I think in certain circumstances you could, depending on what it is. If it's breaking anyone's confidentiality or privacy, you couldn't. If someone's given you consent to share it, and for that purpose, then possibly. But what I would say is to think very, very carefully about that, and absolutely don't go and do it without getting the permission of your organization and by following the correct procedure and policy. In some circumstances, obviously, we share videos and learning things, but if you work for an organization, you need to make sure you follow their policy. And most, as Felicia said, most organizations have a social media policy, and they also tend to have a designated person whose responsibility this is, who is an expert on this subject. So I certainly wouldn't do it without following the correct procedure and making sure that those people had given the proper permission to do it. Does that answer your question?
Thank you very much, Stuart. Guys, we need to move on now because of time. Thank you so much. Really appreciate that. I would like to introduce our last speaker, guest speaker, Wendy Olayiwola. She is the president of Nigerian Nurses Charitable Association, UK. Wendy, you're most welcome.
Oh, thank you. Good afternoon, everyone, or this evening, I must say. A very good evening to everyone, and thank you to Elizabeth and the team for inviting me to your platform today. And I think it's been really fantastic to hear from Felicia and Stuart. And I must say that I'm coming as the last speaker, and they've said it all really. So I guess for me, it's about reiterating what they've already said. And I'm going to start with a question that Prime Rose actually asked in terms of if there has been anyone struck off sharing appropriate video. I can testify to that I do know a case of a registrant that was struck off because of that. So we really have to be very careful. Could you just make these slides a bit bigger? Thank you. As Caroline has introduced me, my name is Wendy Olayiwola. I am the president of Nigerian Nurses Charitable Association UK, and we are so glad to be on this platform sharing and learning with our Ugandan Nurses and Midwives Association UK today. Second slide, please. Right. Like I said, I would I think it's about going to the basic and reminding ourselves, what does social media, what does it mean? What is the history of it? You know, I think it's quite important as professionals to know the start and the origin and history of this. You know, social media refers to the means of interactions, what it is for. You know, it was created to share or exchange information and ideas in the virtual community and networks. And obviously we do have quite a few around, as you know, Facebook, Twitter, Instagram, LinkedIn, and YouTube. So it's about knowing different platforms that is available and which way and what way and terms of information that to be shared on there. Next slide, please. Understanding the social media. It was originated as a way of interaction between friends and family, and obviously it's grown over many years, whereby the businesses stepped in, the professionals stepped in, and the power of social media is the ability to connect and share information with everyone on health, and it makes the global world a very small world. And that's what the social media has done. An example of social media, like I've already said, I've listed those there, and it keeps growing every day. And globally there are more than 3.8 billion social media users, and again it keeps growing. And not for your information, not many people are on the social media, and we really need to understand that as well. So when it comes to us as professionals, and we're trying to communicate with our patients or and their families, we need to also, because there's a positive side of social media which I will be mentioning during the presentation. We really need to see how we can engage them as well. Next slide, please. So nurses and social media. Again, Felicia and Stuart have also mentioned this, so it's just about recapping what they have said. Social media has saturated every industry, like I said, and obviously nursing and midwifery is not, exceptional. Nurses allow them to connect with personal and professional lives, facilitating conversations, colleagues with healthcare advances, current best practices, and more. Nurses do positively use social media to share challenging and emotional experiences. So there are positive ways of using social media as well as negative ways. Next slide, please. Benefits of social media. Again, just to reiterate, using the NMC guidance to advise what social media can enable nurses and midwives to do. It helps us to develop our professional networks, engage in discussion and debate, assess and provide support. And again, this is what we are doing this evening, using social media to connect and teach ourselves what matters to us professionally and personally, enhance our knowledge, building and maintaining professional relationships, establishing and assessing nursing and midwifery support networks, and being able to discuss specific issues and interests, i.e., we are here this evening, research and clinical experiences with other healthcare professionals, and being able to access resources for our CPD. Next slide, please. So how do we manage social media professionally? And I do know that both of them, again, the previous speakers have mentioned this. We do have NMC code of conduct as well as the guidance on how to behave responsibly using social media. So we have to be well informed, be informed. Make sure that you familiarize yourself with how individual social media applications work. Know their rules and regulations, know their privacy, be clear about the advantage and disadvantages of different platforms. Think before you post. Both speakers have already mentioned that. And for us as professionals, I think some of us just heart on impromptu thing. Oh, this video is good, without even listening or looking at it very well. We just pass it on without really understanding the content and the context of it. So it is important as registrants to realize that even the strictest privacy setting have limitations. So this is because once something is online, you cannot copy. It can be copied and then be redistributed. And if there is a problem, they're going to investigate it right to the first person that starts sharing that. And it's important for you to have control over when you send things out. You don't have control over it, and it's better not to send it than to send it and then it goes viral. Protect your professionalism and your reputation. It is very important. So if you are unsure whether something you post online could compromise and your professionalism or your reputation, you should think about information. Think twice. Think, check, and think. Take a pause before you start sending things out. It is important to also consider who and what you associate with online on social media. Your network, for example, acknowledging someone else's post can imply you. that you actually endorse it. So when it comes to you liking things on Facebook or on Twitter, ensure that you know the content of what you're liking and what you're endorsing. Next slide, please. So how does it relate, the social media and the NMC code? Stewart also mentioned that. So in terms of our 4Ps, it has a link. The NMC has really done it very well for us, prioritizing people. You know, you have to be kind to people, you have to be respectful, you have to be compassionate. That is part of the code. So in relation to the guidance of social media guidance, do not post anything on social media that may be viewed as discriminatory, does not recognize individual choice, or does not preserve the dignity of those that are receiving care. So again, it's important in terms of your care, your duty, your accountability, your responsibility as a registrant, you know, when you're using the social media. The practice effectively, which is the second P. Always practice in line with the best available evidence. That is, again, part of our code. So in relation to the social media guidance, as a nurse, midwife, or nursing associate, as it may be now, you have a responsibility to ensure that any information or advice that you provide via social media is evidence-based and correct to the best of your knowledge. A very typical example is during the COVID. A lot of us, we actually push out a lot of information that are not evidence-based, that are not true. We're supporting it instead of us as professionals to actually do our research very well and support our community with the right information. And the third P, preserve safety. Act without delay if you believe that there is a risk to patient safety and public protection. How does that relate to the guidance? So social media should not be used to harass or victimize someone, or to attempt to prevent or discourage someone from raising their concerns. Again, what does that mean in reality? If I do not like Caroline, should I go on social media to actually, you know, victimize her or harass her? So whatever you do outside your workplace influence your professional life. A lot of registrants just think that they have to behave well when only they're at work. No, when you're at home, you need to behave well. When you are on the road, you need to behave well, because if police actually stop you, they can refer you to the NMC. When you are outside your working place, you really need to behave professionally. So the fourth P is promoting professional. I can't see this slide, Elizabeth. I'm not sure if you don't mind to put it.
Professionalism and trust.
Try and enlarge it. Even with my glasses, I'm still struggling. I do apologize.
Can you see it now?
Yeah, it's a little bit better. Thank you. So promote professionalism and trust. Again, what does the code say to us about that? Stay objective and have clear professional boundaries at all times with people in your care, including those who have been in your care in the past. So you can say the past, present tense as registrants. It goes along in our life. There's something that you have signed. As the minute you get your PIN, you have signed whatever you did in the past. Your past can actually follow you through even into your future. So it's important the way we treat the people in our care and the families and the carer. How does that relate? How does it relate to the guidance of social media policy? Should not be used in social networks to build or pursue relationship. Felicia said that clearly and eloquently with patient or service users, or this can blur important professional and guidance on using social media responsibly boundaries. So basically, just not to read all that through, again, is about how you do not use your office, your power as a registrant, you know, to your own advantage, but to the disadvantage of the patient and the relatives. So it is very important. What the NMC has done here is to support us in how to behave professionally and responsibly within the social media world. The social media rules the world these days, and they've really supported us with all this, the code and the social media guidance. And obviously, even your local trust, they also have their policy and guidance. So whatever you do that needs to govern your action. Next slide, please. Misuse of social media can cost you your pain. In my head, I was thinking, you know what, we really need to be blunt, with each other, because I've seen it happen. Over the years, it has cost a couple of people their pain by just sharing confidential information inappropriately, pictures, posting picture of patients, people receiving care without consent, or even, sharing video of underage has cost somebody their pain. Posting inappropriate comments about patients, and not even only about patients, about your colleagues as well. Bullying, intimidating, or exploiting people. And we can just do this without even knowing, but that consciousness needs to come into what we do and how we share things. Building or pursuing relationship with patients or service users. Stealing personal information or using someone else's identity. Felicia alluded to that. Encouraging violence or self-harm. Inciting hatred or discrimination. Fighting at work. And then you're now videoing or recording those activities and then now sending it around. Because you think one line, excuse me, you think one line is good in a video or in a text, then you send it off without even reading the whole context. Those are the things that get people into trouble. So we really need to be careful, read through it before you share it, pause, think, and think again. Next slide, please. Positive ways, registrants can use social media. It comes with its positivities, and that is the truth. And we are actually in the digital world. So everything is digitalized. Even the patient records is digitalized. Our lives is digital. So how do we, make a positive ways of doing things? I'm going to use my second laptop, Elizabeth, because I'm struggling to see that slide. So forgive me. And if I'm struggling, I'm sure, I hope people are not struggling to see it, So there are positive ways, that we can use social media. And one of them is writing blogs. Yeah, go back to that. Okay, thank you. Writing blogs, sharing the research evidence, article through writing blogs, increasing visibility through online presence that can help nurses advance in their career, leading in some cases to a promotion and obviously raise the profile of nursing and midwifery. So there are positive ways of doing that. Reading blogs, from nurses, the opportunity to teach as we are doing today, inspiring others and finding support. Again, that is a social media value. In addition to promoting our values within the workplace, nurses can also use social media to promote their personal health related endeavors and interests. You can use social media within our community for health promotion. So it's important that we look at the positive side of social media. Twitter, I tweet a lot, and I know Felicia tweets a lot. A lot of us tweet a lot, and that is a good way. It's a very professional way of communicating through a wider professional group. So Twitter is a very popular real-time form of communication. It's one of the easiest way to maintain contact. If I want to maintain contact with the Uganda organization promptly, I'll just go on Twitter, tag you, can you DM me, direct message me. So, and then if I want to pass on a message of how fantastic my day has been at work today, I can go on Twitter, I have a great day today, I learned ABCD, or, without disclosing any patient details. So Twitter is quite good. As you can see, Twitter has actually more professionals use Twitter. Facebook is one of the largest, social media platform, and giving nurses the opportunity to help bridge the information gap between healthcare providers. Again, you really need to be careful with Facebook because you can post videos as well as pictures, and when you put things out there, it's hard to take them back. Hence, with Facebook, you just If you really have to use it wisely. It can be a discussion group. Social media also provide nurses with an outlet which they can connect with other, healthcare professionals. Emotional and educational reasons. I think somebody asked the question around that. If we can use social media as a form of that. Absolutely, indeed. That's a positive side of social media. So there are a lot of positive, if you don't mind to go to the next slide, there are a lot of positive sides, how we can use social media. But again, even with its positivity, there are more negative sides to it. And as professionals, as nurses and midwives, we need to ensure that we are maximizing the use of social media in a positive sense and in a positive way. Next slide, please. I think that was my last slide. Are you struggling? Yeah, that's the one. So basically, in conclusion, as that comes up, social media can be a form of using it as a feedback. The culture of social media within our profession is growing every day and it's becoming bigger and bigger. So my advice is, in as much as social media rules the world, we as registrants, as nurses and midwives, needs to be in control of the use of social media. Thank you.
Thank you very much, Wendy. That's quite thought-provoking. If anyone has any questions to ask Wendy, please feel free to raise your questions. I've got mine in the chat actually. This is I've seen a lot like on Facebook where somebody comes up and say, oh, I've been feeling like this and I've got this and that, or maybe even share a picture of their child, but maybe without the face, but just, he's been doing this and he's suffering from this, blah, blah, blah. And then people come, messages popping up, at times even health professionals diagnosing and saying, oh, I think he's suffering from this. I think so-and-so is suffering from this. So what are your thoughts about that?
I think I would probably advise whoever that is doing that to, number one, to go and see the GP. Because again, you cannot make an accurate diagnosis just by seeing picture. And for us as nurses and midwives, we are not trained to actually diagnose. We do give advice and traits. So it would be nice to advise that individual to seek medical attention. So if you are in such a group and that conversation is happening, I think our role is very much to reassure and to signpost accordingly.
Thank you.
I wanted to ask, hi Wendy, it's just a quick one. Hi, it's Tim. I just wanted to ask, what are your thoughts on the discussion of like controversial things in private groups, like closed groups not open to the public? Say for instance, we've had instances where we've seen some video clips involving patients, other patients who we do not know. It might be from America or Venezuela or somewhere, but clearly you can see it's a patient who was receiving treatment and they were ill-treated in that clip. But it's then shared in a private group and there could be discussion points. What would be your views on that?
I don't think, Tim, I must be honest with you, there's nothing private when it comes to social media. There is nothing private because that can be requested to be seen by the police or the higher authorities when it comes to light. So my advice again is to highlight it immediately and for the person to take it down or to exit, full stop, and NMC actually advise that should be reported. That is what the NMC guidance actually advise. So such video, such conversation needs to be escalated and be reported to the NMC. Hence, that's why it's very important when you belong to a group, you need to know those groups very well. You need to know your network. You need to know the people you are having conversation with. You need to know who you are in the group with because they can actually drag you into trouble.
Thank you, Wendy. That's very clear.
Thank you. So I have one question as well. So what would you term the WhatsApp group, for instance, for the association? Would that be a space for learning, for shared learning, or would it's not a private space? So is it bound, like you've said, to be if it comes to light, to actually give that information up for the authorities to check?
You know what? WhatsApp group is just headache. And as professionals, especially if you have a professional group, which I must say for Nigerian Nurses Association, we have different WhatsApp group of 250 people in each. And then we also have a Telegram of hundreds. So it's really hard to manage, and hence you really need those again, it's about educating ourselves, it's about rebuking ourselves, it's about reminding ourselves our responsibility of being professionals. And I think recently there was a post that somebody thought it was a safeguarding post to bring it to everyone. And I must say to you, Felicia went mad. Take it down, you know, even though that it was an information thinking, okay, just to bring it to light, it was a text, you know, and the individual had to take it down. And we have to educate that individual. This is unacceptable. This is not right. There wasn't any patient information in it. It was just a bit of, you know, uncomfortable read, kind of. So basically, when it comes to WhatsApp group and in professional group, we really have to be clear with our ethos, with our rules, and we really need to continue to enforce it and to remind people. And one of the issues that we have as registrant is it's okay for you to be in a group. You don't even read what they put there. So if you don't read my message, how should I read your message? You've already told them, do not post into this. This is the rules and regulations. They have not read it, I can tell you. They will then now put exactly what you ask them not to do is what they will put there. Do not think twice to exit them. I am very straight when it comes to that. I exit people, you know, because again, we are in a profession that we learn every day. And if we cannot influence ourselves positively, then there's no need for us to align together. There's no need for us to be in the same group together. I think we've gotten to a point that if one is in trouble, all is. And I think that message needs to go out. If I am in trouble, everyone is. And if I am good, everyone is good. So it depends on which way we want to go. When it comes to social media, it is a hot topic and we need to manage it professionally, because whatever we do outside work actually affects our profession as well.
Thank you very much. That is really assuring. And I know, Carol, I'm just going to say thank you so much, Wendy and Felicia. They've been mentoring us, the strategic team behind the scenes, and echoing that strong leadership, that strong, you know, line of professionalism is really, really helpful. Thank you so much.
You're welcome.
Thank you, Wendy. I just wanted to ask Stuart quickly as well. Stuart, I guess, Caroline, are we in the Q&A now?
Yes, we are. Yeah.
Oh, thank you. Stuart, I just wanted to ask whether you've had instances where, just like Wendy has just pointed out, we belong to several WhatsApp groups of professionals, healthcare professionals, but it's such a nightmare to keep up with what's posted. And just like Wendy said, no matter how much you can emphasize the rules and expectations, something will creep up that you haven't read, and before you know it, it's attracted 200 responses. And it might be something along the lines of there's a learning point from it. Have you been involved in any, or what are your thoughts on private WhatsApp messages for professionals where people might share things with a learning perspective, where they say, yeah, there's something to learn from this? What are your views, Stuart?
I'm not aware of any instances where we've had members taken before the NMC or employers on something related directly to that, but I'm obviously not aware of every case, so it is possible that that's happened. But I would say again what I said during my presentation, which is that you're responsible for yourself, and as long as you can show that you've acted professionally, I think it's very unlikely that, you know, if you have good representation, that you would have a negative outcome in front of the NMC or your employer. I think there's that, you know, no one wants to discourage healthcare professionals from learning from each other. So being in a WhatsApp group is great. And, you know, I don't think anyone would say you shouldn't do something like that. And I don't think they could reasonably expect you to monitor something like that 24/7. So if you're the administrator for a group and someone is clearly sharing inappropriate things that you think are unsafe, what I think the NMC or your employer would look at if it came to their attention was how you responded to that. So if you could show that you've responded fairly promptly to something, and you've, you know, when you became aware of it the first time, you took some action to protect the public or protect whoever, I think it would be very unlikely that you would have any negative outcome because of that. If it's a repeated thing, you know, if someone's really doing that often or something, or you're in a group where very, very dodgy stuff is going on, then I think you've got responsibility to, you know, if that's another registrant, you might need to report it to their employer or report it to the NMC. If you're the administrator for that group, it might be you need to expel that person. So you're trying to protect the information from everybody else. But like if it's a one-off occasion and you know, you've tried to respond reasonably, I think it's very unlikely that you would have any real problems because of that. So again, you can't police everybody else, and that's the difficult thing about social media. You know, Caroline asked that question about patients recording things, and other people can share stuff with you. You can't control everybody else. You can control your own actions, and if you can show you've acted reasonably and professionally, then I think it's unlikely you're going to have real problems.
Thank you, Stuart. And one last question, sorry, Caroline, one last question. It's to do with everybody has their own beliefs and opinions about everything. Currently, we're into the COVID vaccination. Lots of conspiracy stories, lots of misinformation and disinformation going on. And unfortunately, some of these are sometimes held by healthcare professionals, you know. What is your take where healthcare professionals hold, especially with healthcare related matters, where they hold a divergent view? And secondly, about people having political opinions, political beliefs, religious beliefs. What is your perspective to that in regards to healthcare professionals?
Is that for me?
Yes, Stuart, and Wendy as well. Sorry, firstly, Stuart.
I think I kind of covered most of those in what I said, so I'm sorry if it's just repeating it, but COVID has definitely made this much harder, and there's lots of different opinions out there. But what I said about in the code about not using your status to talk about something which you're profiting from, not using your status to pretend you're an expert on something if you're not. Just because you're a registered nurse doesn't make you an expert on COVID, you know, and I'm sure we're all in WhatsApp groups where we've had different messages from people, but you are, regardless of your own personal opinions, you should only be giving advice that's based on evidence or on best practice. So if you're sharing information, it should come from reputable sources. You know, sharing information from NICE or Public Health England, etc., is fine. If you share something from a website where that's denying the benefits of vaccination or that's trying to undermine people's trust and on the basis of completely spurious evidence, then you better be pretty sure what you're sharing, because that could get you into trouble, and quite rightfully so. So you need to be really, really careful, because there's a lot of difficult stuff going around about COVID. And I think you need to be really careful about your own personal. You may be someone who's worked on intensive care or worked in the community with people with COVID, so you might have some good experience, but you do still need to be very, very careful about advice you're giving online, because you're not in a proper relationship with that person who's asked you for advice. We all have aunties and uncles that will call us and ask for something, and you know, we all have to be careful about what we say. You have no control over what you say online. They could take that and share that in a WhatsApp group with 1,000 other people. So if you're not 100% certain about what you've said, then you could again get in trouble. So be very careful. Only speak about things that you're very confident about, and don't promote things that are not based on evidence. And I'm sure, I think some of what Wendy shared was really good around that as well.
Thank you.
I'd like to thank everybody that has made it to this meeting. Unfortunately, there's been a lot of people that have been trying to get into the meeting. There's been some glitches with the system, and they've been struggling. So otherwise, we'd have had more people on the chat here. However,
sorry, I think Wendy was supposed to answer that question as well.
Oh, really? Okay.
And that's fine. Stuart actually summarized it very well. But I think what I would just add to it is it's quite, I mean, being realistic with this pandemic and the vaccination, it's been a journey for all of us. And, you know, actually balancing your personal and professional view when it comes to the vaccination is a hard one. It's really a hard one. So I always advise people, do not be too hard on yourself. Just like Stewart said, when it comes to the information, as professionals, we really need to step into the professional bit and provide the right evidence, the evidence to support, the patients in our care. So I wanted to use the word woman because I'm also a midwife. So when it comes to using the word patients, I'm not really used to it. So I'm really being cautious of not using women, being a midwife. So it's important that we provide the right information and we bust all the myths. And part of our role as nurses and midwives is really to be an advocate, to provide that support with the right information. And when it comes to ourselves, and do not forget, I think it must be Stuart or Felicia that mentioned, we are professionals that are highly respected. People trust us. We are well trusted. So whatever that comes out of our mouth, a lot of people will believe us. So it's important that we do not give out wrong information or what we think it is right, even though it is not. And when it comes to our professional values and our personal values with vaccination, we still have a lot of work to be done. I'm not sure how many, I guess it's an opportunity to talk about vaccination, to be honest. People, I always say to people that do not force them, they will come around eventually. It's about, it is not time. They are not saying no, but they just want a bit of time. And we just need to wait for them to come around, continue to support them, continue to advocate the reason why people need to be vaccinated. Because if you're safe, I am safe. So as professionals, you also find ourselves in that category of, do I really want to take this vaccine? Before I took mine, I've already taken my 2 doses. And before I took mine, it took a long time, but at least I still came around when I was sure and sure. And that way I could support my community, I could support my family. So again, as professionals, we are trusted. We are also human beings. We are also part of the public, of whereby you really need to get that information to make that your decision. But you need the right information to make the right decision.
Okay, any other comments, any other questions before we close? And I would like to hand over to our interim president, Elizabeth, and then we can have some closing remarks from Primrose Nagala. I mean, the floor is open.
I was actually typing the thank you, and we're very, very grateful. Felicia, Wendy, Stuart, this was a very important topic, and I think the nurses we're working with would also like to learn, so it's good that we can go back to and share it with our colleagues. But it may also be a good idea to share it within the diaspora groups, so that others can learn and share with, especially the student nurses as well. So we're very grateful. I've made notes to share with my team tomorrow, and we're very grateful to the organizers, Elizabeth, Tim, Caroline, wonderful learning. So we're learning not from the experts only, but also mentoring and learning between ourselves. So I just wanted to say thank you so much. We take some of this for granted, but it can affect our lives and our profession. So thank you so much. Thank you.
Thank you very much, our guests. Really awesome, like I said. Wendy, for mentoring us behind the scenes, and for Felicia, thank you so much, Stuart, for your time. We will send the word out so members can join Unison because you have lovely benefits. And Caroline, wow, you did an amazing job, for moderating this session. You have done wonderful. So thank you so much. We try to get our members involved in all the activities, no matter how small. And so it, increases different skills that we have hidden inside. So I think you've done a marvelous job, and I think you'll be doing the next ones very soon. So if there is no other comments, I think we can close now. Or Jean, would you like to share anything? Jean? No. Oh.
I would like to say thank you to everyone who participated this evening. It was really informative. And if there's anything to take away, it's the professional conduct, which I already knew, but I need to emphasize this with my team and all the members on this platform and in our organization. And also continue working together with other, like Nigerian Nursing and Midwives Association, and also the Unison. Come work with us. We are ready to work with you to support you as well. Thank you. We need to welcome you again next time, and please come and join us in our organization. Thank you very much, everyone.
Thank you very much. That is Jean, one of our trustees. Well, I think we've had a good one. So happy, rest of your day, and stay safe. I will see you again next month for another exciting webinar. God bless. Bye.
Thank you.
Bye. We
Bye
hope you
now.
can join us. The next one is on research. Please,
Research.
Wendy,
19th.
research, yes. So please join us.
19th June, yes.
All right.
Thank you.
Thank you.
Bye.
Bye.
Bye. Bye.
Oh, and we're really glad we have people from Uganda joining in. So a lot of shared learning across.
Absolutely.
Yes.
Yeah.
Thank you. Thank you, Ronald, for joining. Bye.
Thank
Bye,
you.
Caroline. Well done.
Thanks,
Bye.
Caesar. Thanks, Ronald. Thank you.
Bye.